Hi, everyone. I'm Dr. Maria Sampoulos. Thank you for joining the podcast today. We will be talking about contact lens options for our patients today. And our guest is Dr. Closson from Johnson & Johnson. Hi, doctor. How are you?
Good. How are you?
Good. I'm excited to have you on today. I wanted to really pick your brain and get a lot of information about contacts there from J&J, and there's been a lot of new innovations. So why do you think there are so many eligible patients that are not wearing contact lenses? And, for every one patient wearing contacts, that's like 31 million. There are two others who are, vision corrected, opening to wearing contacts, but currently not. I mean, that's a lot of, data out there. And what do you think about that?
I think it's really interesting. And I think it's a bit of a disconnect, honestly, between us as doctors and patients. And I think if we do a little deeper dive into this and look at some of the things that we've heard from patients, it's illuminating. And what I mean by that is if you start thinking about your day in practice and looking at your schedule and how your interactions with your patients go. I don't know if you're like me, but when I was seeing patients, I would get my daily schedule and it would say glasses or contacts. And I would just make this assumption that if they were wearing glasses and my staff had already pre-screened them, that I would just go in with the assumption that they were going to be a glasses wearer. I didn't even go into discussing contact lenses with them, and vice versa. For contact lenses, of course, you're always giving them glasses, but I always was surprised when someone would be listed as contacts and come in and they would say, I just want glasses this time. So to get back to that, what I mean by that is I made this assumption that, and so, wrongly, I made the assumption that if someone had been listed as glasses, I didn't even ask them about contact lenses. I just made this idea in my mind that if they were interested, they would ask me, and that wasn't happening. And we've done some studies to see that patients expect the doctor to tell them if they're a candidate and ask them if they're interested and explain contact lenses to them. And we on the doctor side are sitting there thinking, if the patient's interested in contacts, they're going to come forward to us and tell us. So if we don't kind of match together, we're just like, meeting at opposite ends and never connecting in the middle. So I think that's a big reason.
Yeah, that's a lot of good points that you pointed out there, because I do have patients that I said, you're a great contact lens candidate. And they said, hey, my doctor said I wasn't. I have astigmatism. And I'm like, when was this? And I said, 20 years ago. Well, I said, contacts have changed in 20 years. So the doctor should bring it up in the chair and should be part of their, opening, comments and discussion with patients to give them the best options. Just like we prescribe progressives or blue light filters or reading glasses. It should be part of that discussion, I think. With patients. What are some key questions and points that you discuss to discuss as contact lens options with patients?
Well, I really try to get to what their desire is and what their hobbies are and what maybe their pain points are. So a couple of different things, because they'll start telling you pretty quickly on if you ask them a specific question. If they're in contact lenses and you say, how are your contacts? They're going to say fine. So you have to give them a few more ticklers. And I love telling people, especially when they're a new wearer, like, you may not even want to do this full time. Maybe you just want to do it part time, but let's try it because it's going to open up opportunities for you. And honestly, I have so many people that then love wearing contacts. I'm sure you have the same exact thing. And they just have this fear. A lot of them have a fear over the fact that they think they can't do it or what it's going to feel like on their eye. And I just take control of that and make sure that I'm the one putting it on them for the first time. And then they're so surprised at how great it is. So I just ask them a lot of questions on, what their day-to-day is and let them know about the technology. And most of the time people are pretty open. You do have every once in a while someone that is a closed door, absolutely. But for the most part, I feel like people are really open when you are giving them good questions.
Yeah, I mean, even if you get patients that just, primarily eyeglass wearers, what I found is, saying, hey, if you have a hobby and it's sports, going to the gym, and you don't want to wear your glasses, then hey, I can fit you in a daily lens, and maybe and you just get a 6 months supply and it lasts you a year or 2 boxes. And I find that patients are open to that, and it just makes things more flexible. And as they get comfortable with it, they like it. The next year they come back, maybe they do more lenses and use it more, because the more they're educated on it for the options that they have. I think they're more open to having contact lenses as an everyday thing. What are some important factors when discussing multifocal contact lenses with patients?
Oh my gosh, multifocals are absolutely my favorite thing to fit, because I hear over and over, and I'm sure you have the same thing. You already referenced this, that my other doctor said, I wasn't a candidate. I will say to someone, once I know their refractive data, have you thought about multifocal contacts? Because it is a huge pain point for new presbyopes. Everyone across the board, whether they've been in contact lenses forever or they're that in brand new, they were emmetropic or slightly hyperopic their whole life. It's a pain point, presbyopia. Nobody wants to be in their mom's glasses or, get to that point or let anybody know. So it's my favorite area, because when I ask them, what I hear often is, oh, I heard from my doctor that those don't work. And before I insert foot into mouth, before I know their full refractive data, I say, let's explore that in a few minutes. And I always say these patients are screen happy. When I put them in these multifocal contacts, they are so excited. They pull out their cell phone, where their font was giant on their text before, and it's like weaving down and around, and they can't fit hardly anything on their screen, or their brightness is up and their battery is dying all, so fast in the day. They just are so empowered by having multifocal contacts. So I love asking people if they've heard about multifocal contacts. Some people have no idea, and others, have the response that they've never heard about it, or that they have had a doctor say that they, were not a candidate. So it's my favorite area. I love multifocals.
What are some tips of getting patients that dropped out in the past back into lenses?
Yeah, that is a really great conversation that I also enjoy having, because when you have someone that's dropped out, it's a great idea to be able to figure out what the reason was. Was it like a lifestyle change, or was it an issue with their contact lenses? And either one we can address, because they could have been in something that just wasn't a daily wear lens, and having a one day is going to be much more suitable for them. And if it was a dryness or discomfort issue, and they don't have any ocular surface disease issues, then I want to be able to address that. And it could be a number of years. As you said before, it could have been 20 years ago and they dropped out, and technology has shifted so much. So I love giving them the example of, what happened 20 years ago with cell phones, and just relaying that into the message of contact lenses and our technology today, with having stability and comfort with contact lenses is dramatically different. So I love being able to tell them that, and being able to put a lens on their eye, like one day Oasis, or Acuvue Oasis Max one day now, and being able to put that on their eye and it disappears. I have people say that all the time. They're like, I don't even feel this on my eye. So they're shocked, when they think back and recollect what they had before.
Thank you so much for joining us, Dr. Closson, on the podcast today. There's a lot of opportunity for contact lens wearers. About 65 million patients not wearing contacts, and it's a big opportunity for a lot of practices to, fit patients. And Johnson & Johnson has a lot of innovative products to support your practice and bring latest technology to the patients.
Yeah, thank you so much. It's been